Welcome to the Birth Journeys podcast. I'm your host, Kelly Hof, BSN RN. I am a wife, a mother of two, and a nurse specializing in the care of women and newborns. In this podcast, we will share powerful journeys of birth givers with the goals of lifting the veil on the birth experience, healing through sharing, and beginning an open conversation to strengthen trust and promote transparency between birthing people and healthcare providers. This episode depicts pregnancy loss. Listeners who are sensitive to this topic may prefer to skip this episode. Hello. Today I have with me Chelsea Atkinson. Chelsea is a mother of three and an esthetician working at Aesthetic Artistry Laser Center. And she is here today to tell her birth stories. Chelsea, welcome and thank you for joining me.
Hi, Kelly. Thank you so much for having me. I'm excited to be here and hopefully I'll say something helpful.
Oh, I know you will. You have so many experiences and I just want to sit back and listen. So
Cool.
Yeah, I'm going to have you go ahead and tell your story.
Cool. My name is Chelsea. And as Kelly said, I have three little kids. I have a 3.5-year-old, a almost 2-year-old, and a 7-month-old. So I had a few kids in a few years. And I feel like I do have a decent amount of experience of what's hard, what's easy, and how to go through this mental health journey as well as physical recovery. I'll just kind of share my experience. And basically, I started dating my husband, and at 5 months, we found out we were pregnant. And we had known each other for 5 years, but we had started dating in July, and we found out we were pregnant in 3 days before Christmas. I was sick on Christmas. I took a pregnancy test and I was like, oh my God, I'm pregnant. What am I going to do? I had all these thoughts and I didn't know. So starting out, it was really, really rocky. I had hyperemesis. I had a bleed early on. I think it's called a subchorionic hemorrhage. On New Year's Eve, I started bleeding a lot, and New Year's Day I went to the emergency room and they were like, you're going to watch out for a miscarriage. And so I had to go on pelvic rest. And it was crazy because no one, I guess, sees you until you're 7 or 8 weeks pregnant. And at this point, I had just found out I was pregnant. 3 days later, I'm in the emergency room. I was 5 weeks pregnant in 2 days. And I'm freaking out because no doctor's office would see me. No OBGYN would see me. And I was terrified. And so, I reached out to a friend of mine who knows a high-risk doctor. And she immediately took me in the palm of her hand and just walked the journey with me through my first pregnancy. And that was I think all my pregnancies were rough, but I think the first one was exceptionally hard because I didn't know how sick I would be and for how long. And I didn't know that I was going to have muscle tearing and feeling pain the whole time and have a bleed where I was afraid about losing the baby. And there was so much unknown and this relationship was so new and I was just terrified. And I do struggle with mental health issues. And I had been taking a medication that my doctor, my psychiatrist at the time decreased when she found out I was pregnant because there was a low possibility of having spina bifida with the baby. And so I was basically suicidal, wanted to fly down a flight of stairs, wanted to jump in front of a car. I was not doing well. And I did some research and found a psychiatrist who actually was able to stabilize me. And I found that becoming a mom, physically carrying a child, I realized that it was the first time in my life that I really had to take ownership of my body and ownership of my mental health. And that if I could barely get off the couch and was starving myself for years, I couldn't bring joy and love into a child's life if I hated myself that much. So it was really, I feel like my daughter came in and saved me and allowed me to have this relationship blossom with my husband or my future husband at the time and become a mom. I was nervous. And I remember a friend of mine was like, it only takes one sperm and one egg, and that one baby is what God gave to you. And it made me just realize that I could be okay with this. And no matter how it looks and how messy it looks, it's okay. That's how I felt about it. Going through that pregnancy, I started having anemia. I threw up the whole time. No one would give me Zofran or any medication. I just was sick. They were like, this is normal. I'm like, okay, but I'm barfing all day. I feel effing horrible. And they're like, no, this is just how it goes sometimes. And then I got anemic when I needed 8 iron infusions once a week. For 10 weeks, I went in and I needed 8 iron infusions. So they had to give me an IV. I had to go to an oncology office, a hematology oncology. They had to hook me up with an IV bag of iron. I had to get B12 injections. And then at 32 weeks pregnant, I had preterm contractions. So I was in the hospital 3 times in 10 days, and they were like, you need to stop working on like modified bed rest at that point, because they put me on something called nifedipine to help with the contractions. And it made me feel like I was underwater. I felt like I just was not myself. And then I would get up and start walking, and I felt like I was having a panic attack. So I couldn't get up and go to the store. My doctor was like, then you just need to rest. That was most of the pregnancy. And then I go in to have the baby and I'm freaked out. I'm so scared. I had a 39-week induction because I was like, I can't be pregnant anymore. This baby's huge. And they did an induction and I went in at 7. They hooked me up with the Pitocin around 9 or 8. And I had her at 6:04 p.m. So it was pretty smooth. I pushed for, I think, 30 minutes. She came out. She was 8 pounds. I held her for the first time and it was so amazing. I always say that the best day of my life is the day that I meet my babies, because it's just literally holding a miracle in your arms. It's just so cool. So that was the experience with my first daughter. And I had a 2nd-degree tear, so the recovery was painful. I didn't know how painful it would be, how long I would bleed for. I had a little bit of complications afterward. It was pretty rough physically, and I wasn't really expecting that. It's like the first time you do anything, it's like trial and error. You figure it out as you go. And it's not like riding a bike. It's like getting on a bike that you've never ridden before and then flying down the street, figuring out like, how do I hold on? That was kind of overwhelming. And then I struggled with postpartum depression and anxiety and these awful fears of harming my baby. And I had breastfeeding issues. And so I went to a lactation consultant. She was like, you have to breastfeed for 40 minutes on each side, which is like an hour and a half, right? And then you have to pump for 30 minutes. And then you have to give the baby a bottle. So that's called triple feeding. And so by the time that process is over, it's been an hour and a half to 2 hours. And then your baby needs to eat again. So you're literally just depleting everything in your body in every aspect because you don't have milk. And then you're getting up, you're cleaning all these supplies, bottles, milk parts, pumping, all this stuff. And then you have to do it again. And so I got to a point where the baby would cry. And I was like, I don't want to feed her. I was so touched out. I was in so much pain. I felt like I was getting all of this pressure. The lactation consultants were not very nice to me, and it was just traumatizing. And so I was like, screw this. I'm going to do what works for me and my baby. I started giving her formula. I fed her when it was convenient and nice. So like in the morning, I would wake up, I would cuddle, we would breastfeed in bed. I would work all day. I wouldn't pet at work because it was too much for me. And then I would get home and I would feed her. And we did that for a couple months. And by the time she was 5 months old, I was like, I'm going to do a chemical peel. I'm ready to focus on myself. And I felt like that ending that journey of breastfeeding really was a way that I got back on track with my mental health for me personally. And I always tell my friends, I have a lot of friends who are new moms and they're really struggling. And I'm like, listen, you do what works for you. And what works for you is what works for your baby. And the bottom line is that's what's important. It's between you and your doctor and you and your partner, but really between you and yourself. So that's round one. And I had my daughter in August of 2019. So we go into COVID 2020. She's 6-7 months old. I found out I'm pregnant. And the baby has a very low heartbeat. And it took 10 days to hear that the baby was not viable. So I go in on May 4th. The heart rate was like 55 beats per minute, which is very low. And I'm having some spotting. I'm not feeling like I'm pregnant. And they're like, we have to watch for miscarriage. And then on the same day, my sister's wife goes into the hospital to have her baby. And they had her the next day, May 5th. And I just felt like I'm like waiting for my baby to die and someone else is bringing a baby into the world. And it was one of the most painful experiences that I've ever been through. And this is kind of gory, but you're waiting for it to come out in the bathroom. You don't know what's going to happen. I'm getting chills thinking about it. It's just you're in this waiting process and you have no control over what happens. And this happened on May 4th. And then by the next week, that Wednesday, it was clear that it was not viable. And then I had a DNC on May 15th. So it's like this time 3 years ago that all of this happened. And it was horrible because it was the beginning of COVID. So my husband couldn't come to the hospital with me. So I was in the hospital. I was having the surgery by myself. All these people are coming up to me and they're like, you're so young. You've had a healthy baby before. There's something genetically wrong with this baby. That's probably why it's not coming to fruition. And I'm like, screw you guys. You don't get it. It felt like people were trying their best, but no one understood what I was going through. And so it was devastating. It was one of the most devastating experiences. And I have a lot of friends who are women. We're all in this like mom's club, I call it, where we have like group texts going and we're all really supportive. And anytime someone asks me, I know someone who's going through something that you've been through with us, I'm like, send them flowers. There's nothing you can really do. But when I came home from the hospital, my friend had sent me this beautiful bouquet and I felt like I was being seen and heard. And that was the one thing that made me feel better. And then my dog knocked them over and I was like, the flowers. I was like, oh my God, the flowers. And so of course that was just a hard day, but I really knew that I wanted another baby and I was going to do what I could. So I got pregnant again and I had another miscarriage. And that was May. I got pregnant in July and miscarried September 3rd of the same year. And they sent me I went back to my high risk doctor and they found out that it was a blood flow issue. They put me on baby aspirin and I got pregnant 5 weeks later. And I have my baby Bella. She's a little rainbow baby. And I knew that she was ready to come into the world because her due date was my husband's birthday. For the little birth announcement, so we have this inside joke about Krispy Kreme because we deliver our babies at Shady Grove and there's a Krispy Kreme right across the street. So I got half a dozen donuts and I put the pregnancy test, which is kind of gross, but I put it like in the box of donuts. And I wrote on there, our rainbow baby has the same birthday as its daddy. And as soon as he saw the box of donuts, he's like, what's going on? And then he opened it. And her pregnancy, I had hyperemesis, but I wasn't as depleted physically. And I mean, all my pregnancies are hard. In the beginning was really hard because I had like a 1.5-year-old or a 1-year-old and I'm like trying to take care of her and I'm throwing up a lot. But it was really the best pregnancy experience I think that I had out of my 3. I mean, it was the easiest delivery too. I went in there at 9. I had her at 3. I thought she was going to come out. Like I was laying in the hospital bed and I went from 3 to 10 centimeters of an hour and I'm like freaking out. I'm like laying there and the nurse is like, okay, I'm coming to check on you. And all of a sudden I'm like, I feel like the baby's going to fly out of me. I feel like she's like in my vagina. Like this baby's coming out. I start freaking out. Like, honey, you have to get the doctor. And I'm sobbing because I'm like, what if she comes out? No one's in here. And I have an epidural and I can't feel anything. I could just feel the pressure. Thank God that epidural worked because my next one didn't. So that was just easy. I pushed on 2 contractions. She came right out. It's like 2 contractions, 3 pushes each. She was there and she came out and she looked beautiful. Like her name's Isabella. We call her Bella, which means beautiful. And she's just like this beautiful little angel. And I immediately felt connected with her. And breastfeeding was so easy with her. I exclusively breastfed for 7 weeks. And I was like, this kid is too obsessed with me. She won't sleep on anybody but me. And at that point, I switched psychiatrists. And this one was through my insurance because obviously like these things get expensive. And he switched my medication when I was like 2 months postpartum to a medication that did not have good side effects. So I had a really, really, really significant depression at that point. I just plummeted and I got off of it and I found someone new and I was a lot better. But to me, that means I really have to be mindful of who I'm entrusting my mental well-being with because I can't play around with that. Not that anybody really can, but you shouldn't. That was my experience with Bella. I'm like starting to talk slower because I'm thinking about everything that's happened.
Yeah, that's fine. You can take your time.
I think it's also like a trauma response too.
Yeah, it's fine. You can take a breath. I do have a couple questions. Would that distract you or do you want?
You can ask questions if you...
Okay. We'll try to regroup and change the subject a little bit before we go on. So you have had several psychiatrists. Did you end up sticking with this final one? And was this one the perinatal mental health specialist?
She was the one I went to with my first one. And she took health insurance. But after you kind of like graduate, so you can only see her up to like 6 months postpartum. And then you have to see her as a private client, which you have to pay like $500, $600 for a consult. At that point, I was like, let me try to see. So with Gigi, my first one, I saw her. And then postpartum with Isabella, I saw the second one, who was through my health insurance, and it was telemedicine. It just was not the right fit. And then I switched because I knew I needed someone new, and I knew I needed someone with mental health. I struggle with addiction. I've been sober for 13 years. And so I needed someone who understood that part of my brain. That means a tangible fix to something.
Yeah, you can't relapse when you have a baby.
No. And who also specializes in ADHD and all the things that I needed. I found this woman, and she actually knows the first woman that I went to, but it felt like she just came wrapped in a bow. Everything that I needed, she had. She does research with women's health, and I was like, I want to go on Ozempic. She's like, I've been doing research on that. You should wait. And so I feel like everything that I talked to her about, she has experience with. She's very expensive, but she has been critical in my recovery from this last baby. When I get to this last pregnancy and this whole experience with this last one, because this one has really been really hard, she has been so wonderful. She is amazing.
I do think it's important to have a perinatal mental health specialist because there are so many doctors that don't know what to do with pregnant and postpartum women and don't know what the dosages are and don't know what's safe to take during pregnancy and don't understand the safety risk of not staying medicated during pregnancy.
I know people who have tried to get pregnant and then they're told to go off of all of their psych meds. I'm like, when I was off my psych meds, I was the high risk to my baby. It wasn't the medication. And I think that's where my high risk OB really took me seriously, because every time I went in there, she would ask me about my mental health. Every time I went in, and my regular OB didn't. And so it was like, there is definitely a lack of continuity of care where you go. And I feel like I was really lucky to find the people that, like I said, held me in their pocket and really wanted what was best for me and my baby. And I'm friendly with my high risk OB. And I told her, you saved my baby's life. You really did. Because when I saw you, I was not ready for any of this. And I feel like there isn't enough support for women and education for them. And I think there are a lot of things that can be avoided.
Oh, for sure. Yeah. The hospitals that I work at are high risk. And I see patients who come in with medical issues that they can't manage because of their mental health issues. So then the dangers of somebody that's coming in with their diabetes completely out of control because the brain fog and confusion and depression doesn't allow them to take their medication, with people whose blood pressures are out of control for the same reason. And why? Because we think we need to taper down the medication that they were taking for their mental health. But that just starts this downfall of the whole human being. And it's horrible. We definitely want people to continue to take their medication if they need it. So then, are you still with the same psychiatrist?
Yeah, I am. So I've been seeing her this last pregnancy, and the postpartum period has been really, really hard. Mm-hmm. And so I've been needing to see her a lot. She's been great because she's really realistic about medication versus life. And she practices more mindfulness stuff. And she's like, Chelsea, maybe you should look at this, or maybe this work situation is not really quite 100% where you need it to be. Or maybe you need to be patient with yourself and exercise or meditate. Or she's very holistic. And so it's been really good because sometimes I think it's like when we're struggling, I just want something to make my life better. And sometimes medication can do that, but other times it's like a combination of, well, what else can I do with my environment? And I can't change my kids. I can't change my husband. I can't change work really for the most part. I can't change my in-laws or the health of my family. There's a lot of things that are out of my control. And so she's really good with matching where you are with medication and what else you can do for your overall health. And so I love her.
We all have to learn how to deal with our circumstances, the thoughts that we have to have about our circumstances and how that makes us feel and how that makes us function. And why isn't that taught in school? First of all, mindset is important. And I think a lot of people feel alone, especially in motherhood. You feel like you're the only one that's going through this, and there's not always people that have had that same experience. And just to feel validated and to know that, okay, this is a normal experience that people get through, and this is how they do it. And maybe I just need to reframe or find some creative solutions. It's learning to be resilient and learning to deal with those circumstances. And I think that it's just not something that we really teach kids as a society. And I think we need to.
I've been teaching it to my kid.
Yeah.
Because I'm like, Lord knows this kid needs what I need. She's cut for my cloth.
Yeah. I have my daughter listen to mindset podcasts, and I got this mindset workbook for her because, and my mom pointed this out when she was like 2. She's like, she has the same anxiety that you did because I always held myself to such a high standard and would get mad if I couldn't do something right away. And that turns into this whole spiral of anxiety. And I'm like, I need to fix that, but I don't know if I have the tools to fix that. So I guess we're going to do it together, which is great, because if your kids see you fixing yourself, then that normalizes growing as a person. And then they have the tools to fix themselves later in life as well. So I just think, it's wonderful. Okay. So then on to your third pregnancy. So you got your mental health stuff figured out. And
so I'll tell you. So my second and my third are 15 months apart. So I got pregnant when Bella was 6 months old. I had stopped breastfeeding. I had one period and then I got pregnant. And I feel like I try to be delicate because there are a lot of people who suffer with infertility and I never want to make anybody feel bad. But I always say I have a problem with staying pregnant. I just don't have a problem with getting pregnant. I got pregnant when she was 6 months old. And at that point, I just had COVID. I got COVID basically when I got pregnant. And then I got a sinus infection. And then my husband was traveling 3 times a month for 3 months. So like almost every week he was gone traveling. So I'm pregnant with hyperemesis. I'm sleeping with a Tupperware container in my bed to vomit in. I'm taking Zofran around the clock, the 8 milligrams, because the 4 milligrams never did anything for me. And the 8 milligrams, I'm still vomiting. I'm just not going to the hospital.
Yeah.
I'm laying in bed daydreaming about an abortion because I'm so exhausted. I'm so sick. And I want these kids. I want them. But I'm not okay with how physically sick I was and my husband traveling. And then we have this tiny house in Kensington. So then we needed to get a bigger house because we're going to have 3 kids.
Yeah.
So then we're looking for houses. And then we have to take on this brand new mortgage. Like it was like a perfect storm of everything and all good stuff. But all of it together was so hard and overwhelming. It was just, from the beginning, it was difficult. And then I have these 2 kids and both of my kids have tight hips and they have pointy toes. So they needed physical therapy just to walk. So I was dealing with that with Bella. And she also had a corrective dock band helmet, her flathead. So I'm dealing with that. And I feel like it was just a combination of everything. So the first couple months were challenging. Then we moved. We were living with my in-laws for 6 weeks while we were doing renovations on our new house. Then we move in. We all get COVID again around Bella's first birthday. So I'm 7 months pregnant. I have COVID. My 3-year-old Gigi, she was almost 3 at the time, couldn't walk up the stairs because COVID had hit her so bad that her whole body had aches and pains. So I'm the only one that had already had it. So I'm like watching DIY videos of painting furniture, and I'm painting furniture in my brand new garage and with COVID while I'm like 6 months pregnant, just trying to do something to like get out of the insanity that is my life. And I stopped working because I'm pregnant. I'm going to have this baby soon. I decide to quit my job and get another job, which of course is stressful as well. And we end up having to fire our nanny. So then I'm with my traveling husband, my 2 kids, my horrible pregnancy. I'm anemic again at this time and I needed iron. My resting heart rate was like between 100 and 115, just sitting down like I was sick. And my hemoglobin and hematocrit were like 9 and 26. I was not doing well. And then I got cholestasis. So I was throwing up from the nausea, and then I was throwing up because I had cholestasis and I was getting reflux, which was making me throw up while I was sleeping. And I was extremely itchy. And because of the anemia, I'm scratching and itching, and then I'm getting bruises all over my body. I have these little kids, and now we have this house with 3 flights of stairs. So I'm lugging my kids up and down the stairs, and I have to fire my nanny because she was making unreasonable demands on us. And it was horrible. And for anyone that doesn't know, you can have stillbirth with cholestasis. So you have to have an induction at 37 weeks. And I've already had 2 miscarriages early on, which was devastating. And then the thought of having, God forbid, something else happen with a child who is full term, it's all just terrifying. And take someone with an anxiety disorder and then you give them this diagnosis. And I was just ready for this baby to come, but he was not ready to come. So I'm thinking, okay, my first 2 pregnancies, pushed him out. The second one was easy breezy. This one's going to fly out. I'm going to go in. They're going to induce me and it's going to be a piece of cake. Well, I went in and was induced. They gave me Cervidil. It took me 25 hours, which was insane. I went in and they did the Cervidil, and I guess I should explain what Cervidil is. So they basically wanted to make the induction easier. So when they put you on Pitocin, your body just doesn't go into overdrive. So the Cervidil, they just put this thing on your cervix and you have to sleep with it for like 12 hours and then it makes the Pitocin work better.
Yeah. Well, you also were going in at 37 weeks, so your body was not ready.
It was not ready.
It's kind of not surprising that it took longer because your cervix was not aware that you had cholestasis and that the baby needed to come out. Those two areas don't communicate. They're not like, oh, I'm going to malfunction, so I'm going to have you deliver the baby. And so the Cervidil will soften your cervix and just make it stretchy and pliable so that when we start the Pitocin, we're not just knocking a baby's head up against a closed, locked door.
Oh, that's
you
a
know,
good way.
it's like if you leave butter out on the counter, it's so much easier to cut, or put it in a recipe and stir if you've left it out. The Cervidil does that. And then once you get to the point where they check your cervix and they feel like it's soft, maybe it's 1 to 2 centimeters, especially if you've already had 2 babies.
It was just funny because I was like a closed, barely a 1 centimeter when I went in with my second baby.
Yeah. And probably your cervix was like,
but it was ready to go.
With a third, it was probably like still thick. But yes, with your first, if it was really soft and thin, start the Pitocin. So there's like a whole, we call it the Bishop score. And off the top of my head, I can't remember what all the little parts of it are, but you have to have a good Bishop score to be able to start the induction. And that means it's like softening the dilation, the station, like where the baby's head is in the pelvis and all that stuff. And they look at that, and that's how they decide if you can start the Pitocin. So they probably just needed to ripen your cervix a little bit overnight.
I had it in for 10 hours and I was ready, which is good.
That's good. Yes, because 12 to 18 hours is when you take it out.
So they took it out and then they put me on the Pitocin. At that point, I was having contractions very rapidly. I basically wasn't dilating as fast as my contractions were happening. So then we were worried about the baby. And so they pulled it back. And at this point, I'm like, well, I know that my labors go crazy when they break my water. So I'm going to have them give me an epidural and then they're going to break my water. Like I have a whole thing down to a science, right? Because I like to be in control, as people with anxiety like to be. So they break my water and they give me the epidural, and I'm having contractions during the epidural, and it was very hard to stay still. And this one pinched like the whole way up. Like I felt this pinching all the way up my spine, which I feel like is not super common. Like a lot of the time you just feel like the numbing, that you don't feel the actual epidural. And so that was a little bit of a red flag to me, but the anesthesiologist was awesome. And I just was moving because it was painful. So the labor is starting to progress. The contractions are getting more intense. And then my epidural stops working. I'm sobbing. I'm in so much pain. And usually this happens right before I have the baby, when I'm in the active labor phase.
Yeah. The transition.
Yep. So in that phase, my epidurals usually don't work, but it's usually like an hour. And then by the time I push, they work again. It's just like that phase is just so aggressive. And I'm always vomiting during that phase too. Because why wouldn't I?
Of course you would.
And I'm like, when I go in there, I'm like, give me Zofran. I know I'm going to be barfing. Give me the reflux medicine. I know I'm going to be sick. So the epidural stopped working. They checked and I was like maybe 6 centimeters.
That's technically transition to active labor.
Well, they told me that because I was in so much pain and because they basically slowed everything down, which I think was the problem. I think that they slowed it down because they were worried about the baby. Yeah. And usually I go from 3 to 10 really fast. Like with both my other ones, it happened really fast. With this one, I wasn't progressing the same. And they were worried that, I guess, does it affect the baby's heart rate or something?
So if the baby is showing us on the fetal heart rate monitor that he's not tolerating labor well, then they will slow things down. And what we really prefer is for babies to have what's called intrauterine resuscitation. So when you're contracting, the blood goes out of the placenta. And then as your uterus relaxes, then the blood will go back into the placenta. The baby gets better blood flow, all of that stuff. And so if the baby is reacting negatively to that, they will slow down the labor so the baby can catch its breath, so to speak. It's almost like when you're having a contraction, it's like you're dunking the baby into water and they're having to hold their breath and then you come back up. And if you're doing it like really fast and the baby doesn't really have a chance to catch its breath, like a normal person in water, if they don't have a chance to catch their breath, then they might pass out. Yeah. And so they're just trying to allow the baby to catch its breath. So probably they slowed down your labor for that reason, not necessarily because there was anything going on with your body, but probably he just wasn't reacting well.
Are you pregnant and planning a hospital birth? You don't need a birth plan. You need a birth vision. In my opinion, birth plans set you up for failure. Yep, I said it. Hear me out before you turn off this podcast. You may think that by downloading a generic birth plan, it means you're in control. The truth is, it's not that simple. No one can control exactly how their birth will go. There are way too many variables. What every pregnant person wants is to walk into the hospital pregnant and to walk out with a healthy newborn in their arms. The journey in between is the murky part. It's hard to know what issues might come up that need to be addressed. If you focus your energy on a birth vision rather than giving your power to a birth plan, you can empower yourself to make the best choices for you and your baby. That's why you need to get into my Empowered Hospital Birth program. As a labor nurse and mindset coach, I can help guide you through the process of maintaining the calm autonomy that will help you achieve the birth vision you desire. In my Empowered Hospital Birth program, I will help you identify the source of anxiety you have surrounding hospital birth, fill in knowledge gaps to make sure that you are fully informed and confident, learn key phrases so you can better communicate with your medical team, emotionally process your fears so that they don't hold power over you. Go to kellyhof.com/empowered to book a free 30-minute private birth vision call, where we will identify your top fears and must-haves and gain clarity on exactly how you want to feel in the birth space. That's kellyhof.com/empowered. I'm honored to be a part of your birth journey.
So they did it prophylactically.
Were you contracting too much?
Yeah. I was
Okay.
contracting every 2 minutes.
So if you have more than 5 contractions in 10 minutes, they will slow it down because
That's what was happening.
Yeah. So it's your uterus is hyperstimulated. It's called uterine tachysystole. And so that is a contraindication to Pitocin. So you do have to back off. That's what's recommended. So they did what was right.
So that's what happened.
So,
But then I think it took my body out of what it was supposed to do.
Yeah.
And so they were like, at this point, I would advise you want another epidural, you could get one. I was like, well, I don't really want to have to get another one. They're like, the third pregnancy, the third labor is not always like it was with the first and second. Like the third one's a wild card. I was like,
is.
well, I didn't know that.
Yeah.
That was my experience.
Yeah.
So this is like 2 p.m. And meanwhile, I give birth at 10. It definitely was the right call. I was in so much pain. I was just sobbing and it hurt so bad that I got a second epidural. My high-risk doctor comes in. She like brings me a gift. It's 8:00 and she had just gotten off of work and she's been there 2 out of my 3 deliveries. She wasn't there when I had the baby, but she was there before, after. I love her so much. And I'm in there and we're chatting. I'm like, this is great. I like feel totally fine. And then I start getting nauseous. I'm like, oh God, this is it. This is it. She leaves and I immediately go into that active phase. They bring the anesthesiologist back in. They give me a bolus to try to surge the epidural to work again because I'm in writhing pain. I'm screaming. It felt like unmedicated. I didn't feel my legs, but I felt everything down the center of my body, including my vagina. So it was like the epidural worked, but didn't work.
Right. No, the baby doesn't come out your legs.
No, exactly. Thank you. I couldn't walk for 12 hours after I had the baby, which was terrifying, but my legs were numb. So the doctor comes in and I'm just screaming and I'm like, I can't do this. It was so bad. I was like, they're going to have to knock me out and cut this baby out of me. It was horrible. Long story short, the doctor comes in there and I'm 8 centimeters. She's like, bear down. She pushes me enough to get me to 9.5 so I can push the baby out. And he came out in like 10 minutes.
Yeah.
But it was the most horrific pain. And I know that some of the epidurals still work. Like I cannot imagine. I have a friend of mine who I think would be great for you to talk to.
Yeah.
She had 2 unmedicated. And I'm like, you are my hero. But also what I went through, even if I had an epidural, I'm still a powerful human for doing that.
Oh my God. Listen, anybody that gives birth, no matter how it happens,
is like superhuman.
Yeah.
Right?
Yeah.
And just from there, like it was always hard with him. So he had a lip and tongue tie that was really significant. He couldn't latch, he couldn't breastfeed. Then he had colic for 4.5 months. We got the lip and tongue ties fixed, but then he had really bad reflux. He dropped to the 10th percentile because the formula or my breast milk was making him projectile vomit. He lost all this weight. Meanwhile, he was like off the charts before I had him. Like he was so big in utero. He was above the 99th percentile.
Wow.
So I went from that to having this tiny baby, couldn't feed, jaundice. He was under the Billy light. He failed his hearing test because he had amniotic fluid. So I'm like freaking out that he's going to be deaf. There was just so much from the beginning. I was in the hospital by myself after I had the baby because my husband had to go home to our 2 little kids. And I'm like going through this postpartum experience in the hospital to then being home and being isolated with this baby who's screaming 24/7. And, I think about it now and I like shudder. There's definitely trauma I'm working on with my doctors, but just like the screaming and the crying and the projectile vomiting. Oh, and then at 2 months, he got an upper respiratory infection. He was in the hospital and rushed to the emergency room in an ambulance. And then we were there for 3 days. And then we went back, and then we had to go to children's, and we had to see a respiratory specialist and a cardiologist. And let me just tell you, it was like, I feel like everything that could have happened. And of course, thank God my baby is safe and he's healthy. And it was a lot of really scary things that happened at once. But I felt I'd been through a lot with my first two, with some of the stuff that I had gone through with them with their PT, and the one had RSV when she was 3 months. And you're never prepared. I feel like you're always prepared, but you're never prepared.
Yeah.
And that just took my mind to a really scary place. And that's kind of why I said this experience was different, because it affected me differently and it affected me in a greater way. And you're also spread so much more thin. Once you have multiple kids, it's like I didn't have anything else for those kids.
Yeah.
And then I missed them.
Yeah.
So I have this nanny and I have this childcare, which is wonderful, but I still miss my kids. And then no one can take care of the screaming baby, because who's going to want to take care of a screaming baby? And then I didn't want to go anywhere because he would just cry the whole time from the colic.
Yeah.
So, that lasted until he was about 5.5 months. And now I have him on goat's milk formula. He was on the amino acid Neocate. That was insanely expensive, but my insurance did cover it. But now he's on this European goat milk formula, because why wouldn't I have to do something fancy like that?
Yeah.
But it's great. He's off of his omeprazole. He was on omeprazole for reflux. He's growing now. He's like 95th in height. He's got a helmet too, because why would my kids have helmets for their flat head? But he's now growing into this adorable, sweet little boy. And I just look at my kids and I love them so much. I feel like there were times where I've tossed them at my husband. I feel like as moms, we have to be real about what's going on, because then we'll never talk about it. And then it'll eat us up alive. And then how are we supposed to get better?
Right.
We don't talk about it.
Yeah. I'm there with you. You get so overwhelmed. You're just like, stop it. I'm at my limit. I said something to my husband yesterday that I saw on Facebook, and it was this video of these kids just getting into trouble. 2 little kids. One was a toddler. One looked like they were like 7. And it said, my friend does this thing when it's just getting so overwhelming and you're out of patience. They say that they close their eyes and they try to imagine what it would be like to be 80 years old and to be given the opportunity to have one more time with your kids when they're little. And this is the moment. How would that change your attitude in that moment?
Wow.
And I was like, oh my gosh. Now, granted, I don't need to necessarily go all the way there, because if that were the moment, I would just sit down and cuddle them.
Yeah.
And we would never get anything done.
Nope.
I would let them stay up all night and I would let them eat chocolate all the time. But to put it into a little bit of a frame of reference, because it's hard. Like, those moments are hard, but you are going to miss them. So it's like, how do you strike that balance? Well, you take care of your mental health. You put all those things in place, and then you just work on yourself as a human, but you're going to mess up. You are human.
My friend sent me something. Let them climb into bed with you. Sing a song they request for the 100th time. Hold them a little tighter when they want to hug you. Maybe in raising children, you lose your mind a bit, but boy, do you find your soul.
Yeah. My kiddos sleep with me.
Really?
I'm just like, yeah, because, oh my God, they're up all night if they don't.
Oh my gosh. I let them scream and cry because I'm like, I need my sleep.
I'm bad. I let them watch a movie every night. I put on a movie.
You're not bad. It's what works for you.
Well, and you know what? In the hardest times of my life, I have found that the movies that I've seen over and over again help ground me and help me not go weird places with my head. And so knowing that my daughter has anxiety, I noticed early on that when she would lay in bed without any distraction to try to go to sleep, she would come in with these thoughts and she would have been worrying about something completely out of her control. And I just know that in the times that I have had really tough experiences, like a friend has died, or maybe I just moved and I felt really alone, I watched You've Got Mail like every night for a year.
Oh my God, You've Got Mail is one of the best movies. It's like such a feel good.
It is. It just makes you feel not alone. And so that's what I did. And I noticed that she would fall asleep within 5 minutes if I put in a comfort movie for her, like Frozen, or lately they're watching the Pinocchio with Tom Hanks. Now my son kind of has to bounce around in bed, but he doesn't go anywhere. Our nanny comes in. She's basically a preschool teacher. She's
Amazing.
taught him so much. And if I'm editing the podcast, he'll come down and sleep on the couch or whatever. But it's just, I feel like there's so many rigid requirements of parents. And
I know.
let's do what works, because you're not going to get this time back.
No, and it's so funny because I'll have friends over and it'll be 6:30 and I'm like, the kids have to go to bed.
Yeah.
And I am so rigid because my kids are so hyperactive and they have so much energy and they do not function off of a schedule. Like they just don't.
Oh, yeah.
People will even think that I'm so strict. It's what works for us.
Yeah.
You know what I mean? And so I find that like no matter what, people may think that I'm like a strict mom, but I'm just doing what works for us because if I let my daughter watch The Royal Detective all night, she will. And it's this cute, adorable show and she'll do it, but she will never fall asleep.
Yeah.
Because her brain won't turn off from the stimulation. And so because we know our kids, we know what works for them.
Yeah.
And that's why you can't ever tell anybody how to raise their kids.
Exactly. Yeah. I have friends that are just like that too, that their kids cannot handle having screen time because their brain will not turn off. My kids are the opposite. It turns them off. It comforts them. So yeah. And you also know yourself, if you are the type of person that you can't turn off because you've got that distraction, probably your kids are going to be the same way. I know I saw those characteristics in my daughter and I was like, no, I know it's going to work for her. And my husband thinks it's crazy. He's like, why is she watching movies every night? I'm like, she's not, she's sleeping. If you go in there in 5 minutes, she will be asleep. If you turn that movie off and you go in 5 minutes later, she's going to be asking you about so-and-so's dog that died 3 years ago, because she's going to find some dark space in her brain to go into, and she's going to stay there. So maybe let's find something else for her to focus on for the 5 minutes that she needs to get her brain in the right place to go to sleep.
Yeah.
So yeah, those are the coping skills that we have to teach our kids. What we know works, and maybe it doesn't work for every kid, and maybe we have to be creative with the rest of the coping skills that we teach them. Sometimes the crazy stuff works.
Yeah, we all figure it out on our own path. You know?
Right.
We just have the experience to help others figure out what their path is, I think.
Yeah. And if your experience doesn't work for somebody else, it's okay. We all need to listen to what works for us. So are you planning on having other kids? It sounds like it's been really rough.
It's been so rough. So I've never not gotten pregnant after I was 6 to 7 months postpartum. And I'm 7 months postpartum right now. And I'm like, what is it like to have my own body? This is crazy. What is it like to not throw up every day? This is wonderful. But we can't right now. I think that mentally I haven't had my period in 41 days and that I'm not pregnant. I've taken 15 pregnancy tests. I literally am just so stressed about life right now that it's affecting my body. That's not an environment where I want to have another kid now.
Are you doing something to prevent the pregnancies?
Yes and no. We're actively not trying in a way that has worked for us, but there's nothing super strict that we're doing.
Are you able to tolerate birth control, hormonal birth control? Yeah, I figured that was what was going on.
Yeah, I went on it and it made me really ragey. I'd rather have another kid than want to hit my husband. That's where it takes me.
Yeah.
And I have endometriosis. So there's just all sorts of reasons.
So many reasons
don't really work well. So we just do other stuff. You know, I was talking about it with him today and he's like, the stress of having another kid is really overwhelming. And I think both of us are in that space. But I think I would like maybe when the baby's a year, because I like that 2 years apart age gap, I might look into that. And if I'm not ready, I won't be ready. But I do really worry about the cholestasis. And like, I would likely get that again with another consecutive pregnancy. And then my mind goes to, God forbid, I lose a baby full term. Would it be worth it?
Yeah.
You know, like I have these 3 healthy kids. So that's just, I'm all over the place with it.
Have you talked to the high risk doctor about?
Yeah. And she was like, Chelsea, that's not going to happen.
Yeah. That's what I was.
We're going to take care of it.
Yeah. Did she tell you what your odds are of having cholestasis again?
No.
That might be something that would help your mind move away.
I know it's a very high likelihood.
Yeah.
I don't think it's 100%, but I think I had it with my second one too.
You do?
Because I had a lot of itching and the itching had gone away, but then I had really bad reflux and it wasn't as severe this time. But I remember her wanting to test me for it with the second pregnancy. And I was like, oh, but the itching went away. And it did with this last one too. But then it came back because I think it was more aggressive.
That's interesting. Yeah, I had a lot of itching too, but it was just urticaria of pregnancy, which is just pregnant itchiness, essentially. It's just a
Okay.
fancy word for it. And then there's also PUPS, but you would have had sores from the itching. So there's several things that can cause the itching in pregnancy.
This was definitely the cholestasis because they did the bile acids. Yeah.
And they would be able to test you. I mean, they know, right? They know that it is likely. So they would probably test you early. They would probably watch you closer.
I also think having 4 kids is a lot.
Yes. I'm not telling you to get pregnant. I just don't want you to have your head go to that place if that's what you decide to do.
Well, you have the experience too to guide people and like, okay, well, maybe don't just think about the negative of this. If this is something that you want, there are options.
But not even just not think about the negative, but empower yourself with knowledge. You have this group of people that it sounds like they're really helpful.
Yeah.
Anytime you have any kind of thought, they can help you figure out how to move forward. I can't tell you, what other crazy things will happen because that's just life. Give yourself some time. It sounds like you're in a great place to enjoy everything right now.
Yeah. I mean, we got this house a year ago. We are just blossoming into this new family life, and it's hard to catch your breath. It's hard to get a moment, but I try to look at the days as it might be super, super overwhelming and stressful. But like last night I was sitting on the floor in the kitchen and the baby was in a little, like that little juvie spoon walker thingy. And then the 2 girls were literally on my lap and we're on the floor in the kitchen and I'm bouncing them on my lap. And I'm like, these are the good times that they're going to be this little. And like, I try to take these like mental snapshots.
Yeah.
It's like a mental picture. And I think that helps me stay in the present moment as much as I can.
Yeah. Well, is there anything else that you wanted to share about your journey?
No, I think I took a super long amount of time.
No, you didn't. I've had people take an hour and a half. So
Okay, good. No, I feel like I've been in a pretty good place and I haven't been in a pretty good place.
yeah, it was rough, but worth it.
Yeah. And I think like talking to someone like you, going through everything, it shows how much I have been through and that I can go through a lot in life and I can still come out on the other side.
That's amazing.
Yeah. It's very empowering to look at it as like a whole snapshot and look at, wow, this is what I've been through. And
you're going to be able to listen to it anytime you need to.
Cool.
Well, Chelsea, thank you so much for joining me today.
Thanks, Kelly.
I loved hearing your birth story.
Let's face it, moms are busy. We're so busy taking care of others that we rarely have time to take care of ourselves. I'd love to simplify that for you. I'm offering a free 15-minute hair care or skincare consult to help you find an uncomplicated routine using clean, vegan, anti-aging hair care and skincare products that follow the strict EU standards for safety. For your free consult, just send me an email at birthjourneysrn@gmail.com and we'll schedule a call. I'm excited to be a part of your self-care journey.
Thank you so much for tuning into my podcast. If you enjoyed what you heard, make sure you hit that subscribe button so you don't miss out on future episodes. Don't forget to share the podcast with a friend who can benefit from the valuable insights that we share here. And if you could take a moment to leave a 5-star rating and review, it would mean the world to me. If you're ready to work one-on-one with me to embark on a transformational journey towards a confident and empowered hospital birth experience, go to kellyhof.com/empowered and enroll in my Empowered Hospital Birth Coaching Program. Together, we'll create a roadmap to a birth experience that you'll cherish forever. That's KELLYHOF.com/empowered. Let's make your birth experience extraordinary.